Hey everybody, Dr. Hagmeyer here. In today's video, I want to talk to you about the two most common conditions linked to chronic health problems and things like brain fog, fatigue, gastrointestinal problems, food allergies, depression, anxiety, thyroid problems, any problem related to blood sugar, things like chronic pain and chronic inflammation. Again, all of these chronic health problems often have an underlying leaky gut, and with a leaky gut, we often find adrenal gland problems. Very often when I'm reviewing a new patient's records, the patient will have gone to, let's say, another holistic doctor, maybe a naturopathic doctor, maybe a herbalist, and many times patients will have testing that shows that they have problems with their adrenal glands. And perhaps they have maybe high cortisol levels or low cortisol levels or low DHEA or high DHEA. And based on these results of their adrenal test, the patient will have started some sort of nutritional support, dietary changes maybe, natural medicine, to help build up and revitalize these rundown adrenal glands. And maybe this is you. Maybe you've tried things like ashwagandha and licorice and DHEA, maybe adrenal glandulars, different kinds of B vitamin complexes and vitamin C and so forth. And after about 4 or 5 months, you didn't notice much of a difference. Maybe perhaps you noticed just a marginal difference, okay? So what the heck is going on here? Why is it happening? How is it possible that you have testing that shows that you have an adrenal problem, you receive some sort of treatment, you've changed your diet, and yet you're still struggling, all right? This is a big question. Why you're not getting better? Well, here's why, okay? Number one, it's very short-sighted to think that with any chronic health problem that there's only one system of the body that's causing all of the problems. You know, more often than not, these problems are rooted a little bit deeper than just the adrenals. And after we dig in just a little bit, we start to find out that not only do we have an adrenal problem, but we also have something called a leaky gut as part of this clinical picture, okay? It's not that you don't have an adrenal problem. It's not that you don't need adrenal support. Perhaps you do need to fix the gut first and then come back and heal the adrenals. Or perhaps there are other pieces of your health puzzle like food sensitivities and thyroid problems and heavy metals and mold, food sensitivities, or some other kind of inflammatory reaction going on in your body, or blood sugar problems that are also contributing to these areas that perhaps need attention first, okay? Now, I wish I could tell you that all you need to do is follow this XYZ protocol to heal. I know there's plenty of those on the internet, all kinds of do-it-yourself programs for the adrenal glands, and I get more calls than not of patients who have gone through these do-it-yourself programs only to find themselves more frustrated than ever and having spent a lot of money and not making any progress. So again, because we're all different, we all have different symptoms perhaps, all right? But what I would suggest in terms of understanding this connection is starting to think about other things outside of just the adrenals as being the problem, okay? I would start with things like leaky gut, especially if you have symptoms of GI issues, if you have bloating, if you have brain fog, if you have constipation, if you have diarrhea, if you have hives, and so forth. So if you look here at this illustration of a leaky gut, maybe you've seen this before, maybe you haven't, maybe you didn't understand it. So let me take a quick moment and really just kind of explain to you how a leaky gut causes adrenal fatigue. Okay, at the very top of this page, you're going to see that there's these finger-like projections. Okay, these are called the microvilli, and these microvilli are designed to increase the surface area for nutrient absorption. So when I say nutrient absorption, I want you to think vitamin deficiencies, right? Do you have blood work that's shown that you have low vitamin D? Do you have a history of having low iron levels? Are you anemic? Do you have low vitamin A levels? Maybe you've had some testing done that shows you have low zinc or low copper or low magnesium levels, okay? This might be a clue, especially when you start to see all these nutritional deficiencies, that you're probably also dealing with a leaky gut, okay? Next, I want you to see that between the cells there are these structural proteins called a tight junction, okay? Now, these tight junctions are the sites in which the gut can become compromised. These tight junctions can be attacked by an autoimmune mechanism, or they can become inflamed and separated due to an overgrowth of bacterial toxins, due to heavy metals, due to some other cause. Everybody is different in this regard, and that's again why you need to test to, again, identify not only if you have a leaky gut, but now what's causing the leaky gut, okay? So just like the problem that we said earlier, when someone finds out they have an adrenal gland problem and they start treating the adrenals, the question should be well, what's causing the adrenal glands to tank? If you have a leaky gut or you have a test that shows that you have a leaky gut, that's not enough. Now the question becomes is, well, what's causing the leaky gut? And so that's how I start thinking about these problems. And so, as we relate this back to the adrenal glands, back to the gut, once these tight junctions are separated, many different kinds of bacterial toxins and metabolites of medications, undigested food proteins, large macromolecules can be trafficked across this barrier. Now, once they cross this barrier, they're going to enter the bloodstream. And now they initiate a global systemic immune system response. And again, this is why you see problems with the brain, why you see problems with the immune system, why you see all these kinds of nutrient deficiencies, why you see systemic inflammation, why you see chronic pain. It's this immune response that now goes on to compromise, again, things like nutrient absorption, all the things we talked about earlier. You may start to notice that you have intolerance to smells. You may start to notice that you start having an intolerance to jewelry. Maybe your wedding ring that you've been able to wear for 20 or 30 years now all of a sudden is causing a rash. Maybe you have a watch, maybe you have a necklace. All of a sudden there's intolerances to shampoos and lotions and detergents, skin outbreaks. And then there's also things like chemical sensitivities to certain smells. I've had patients that they have such an extreme case of these chemical sensitivities that every time they walk past the perfume in the shopping mall, they get a headache. Another lady I spoke to, actually just recently, a couple of weeks ago, said that the smell of chocolate, anytime she smells chocolate, she begins to break out in hives. So can you imagine that? Just smelling chocolate causes you to break out in hives, okay? Well, that may not be you yet, but the more we learn about a leaky gut, the more we see it as one of the main triggers behind diseases like asthma, like food allergies, like depression, like anxiety, insomnia. And many other researchers are believing and finding that a leaky gut is really the biological door to cancer and the biological window, or again, the biological door to many cases of autoimmunity. And I can tell you that in my experience of working with thousands of thyroid patients over the years, we often see a leaky gut in probably about 90% of those cases. So what does inflammation and a leaky gut have to do with your adrenal glands? Well, the gut is especially vulnerable to the presence of both acute and chronic stress. And remember, at the root of all chronic diseases is an underlying inflammatory reaction. One of the mechanisms by which your body regulates this inflammation is through a hormone called cortisol, which again is produced by the adrenal glands. Cortisol is a very powerful anti-inflammatory hormone. Even when secreted at normal levels, it acts very quickly to remove and prevent redness and prevent swelling or reduce swelling of nearly every tissue in the body. And it's these anti-inflammatory actions produced by the adrenal glands that help prevent those mosquito bites from flaring into giant lumps and bumps. It prevents the bronchial tubes and the eyes from swelling shut from these allergens. It prevents the mild scratches that we experience and minimizing the effects of a scratch. So rather than looking like a mauled tiger, we just have like a mild scratch. This is also why things like strong corticosteroids like prednisone and cortisone shots are used with virtually all diseases that involve an inflammatory process. And this includes autoimmune diseases like rheumatoid arthritis. These hormones imitate the anti-inflammatory effects of the body's natural production of cortisol, but they also come with undesirable side effects. If you've had your adrenal glands tested and you had low cortisol levels, or you had low DHEA, or you had low pregnenolone levels, your adrenals are not able to keep up with the severity of inflammation and the amount of cortisol needed to help tame the fire in your body. And if this is the case, you can't get better until you address the cause of that leaky gut and what's causing the gut inflammation. And this should only make sense, right? If your gut is inflamed, again, because of a number of problems that we mentioned earlier, your adrenal glands tame the inflamed cortisol, but because the adrenal glands are fatigued and run down, they can't counter the effects of that inflammation until the gut is supported. So remember, functional medicine is about getting to the root cause of the adrenal gland problem. And unlike standard medicine that kind of holds on to the mindset that there's this one cause and one cure belief system, functional medicine looks at the body as a physiological web of connectedness. And I think that's why a lot of people fail to get better, is that whoever they worked with is trying to hang their hat on the fact that the adrenal glands are the primary problem why a person feels run down, fatigued, and tired and experiencing brain fog. So in today's video, I just want a couple closing points, okay? A couple points that I feel are super important to remember, and hopefully it's clear that when it comes to fatigue and brain fog and anxiety, blood sugar problems and thyroid problems and all the other symptoms that are connected to the adrenal glands, that most importantly, we take a step back and we look at what that big picture and what those other symptoms might be trying to tell us. So here are 4 points I want to leave you with. Number 1, today we talked about how a leaky gut can wipe out your adrenal glands. The end result is obviously fatigue of the adrenal glands are going to be things like blood sugar problems and low thyroid and brain fog and depression and chronic pain. Point number 2 is suspect a leaky gut if after working on your adrenal glands for a period of, let's say, 3 or 4 months, that you're not really feeling that much better. You've only improved just a tiny little bit. And when I say improved, I mean you've actually been retested and your adrenal glands are not responding as well as your doctor had hoped for. I don't mean that your symptoms are just gone, because sometimes there's a process of healing those adrenal glands, but as long as you're moving in the right direction, you have tests that substantiate and back up the fact that you're moving in the right direction, you have to keep pushing forward, you have to keep supporting those areas, okay? Point number 3, and this is a super important point, chronic health problems have many, many causes. And adrenal gland fatigue is just one piece of a much bigger puzzle. And if you work with a doctor who is experienced in functional medicine, you may uncover what those other pieces of your health puzzle are, okay, outside of your adrenal glands. And if that's the case, these adrenal glands will recover and you will get better, okay? Leaky gut is one cause of why these adrenal glands are not working, but realize that there are many, many others. If you want to know more about some of these other causes, I encourage you to get my adrenal fatigue report by visiting my website. There's a lot of information packed into that report. There's no way I can address all of those things again in this video, but I try to do this through a series of videos. And point number 4 is that correcting a leaky gut and adrenal fatigue requires more than just taking vitamins and herbs, okay? You need to pinpoint the areas of your life that also need to be changed. You can't keep eating the same way. You can't be involved in the same toxic relationship that you're in. You can't be constantly around the toxic people in your life that keep pulling you back into that toxic gloom and doom environment. You have to break free from some of these people sometimes so that you can heal, all right? So that wraps up today's video. I hope you enjoyed it. If you did, give it a like, subscribe to our channel, share this video with the people that you care about, and most importantly, don't give up. Like I said earlier in the beginning of today's video, sometimes you just need to dig a little bit deeper. Sometimes you need to investigate some of the other areas. So until next time, hope you enjoyed today's video. Take care.